Na karibu tena, unaendelea kutazama Citizen Town Hall kwenye taarifa za Monday Report, ambapo hii leo tunaangazia haki za mgonjwa. Itakuwaje mgonjwa zuiliwe hospitalini kwa kukosa kulipa bili ilhali sheria inasema kuwa haistahili hivyo? Hebu tuzungumze tu na wakili mmoja hapa kuhusiana na hata zile hatua za NHIF wakati ambapo mgonjwa anataka kuruhusiwa kwenda nyumbani baada ya matibabu. Wakili, simama kidogo, utasogea huu pande. Hap.
Asante. My name is Onyango. I work with the Center for Reproductive Rights. My question to Mr. Soro is the NHIF administrative process of clearing claims, including not working over the weekends, consistently subjects patients that are discharged on Fridays to detention for 2 extra days until the next working day for NHIF. How are you addressing that, and how are you dealing with complications arising under the Linda Mama process that you do not cover, hence subjecting those women who suffer complications to be detained when they are charged for extra costs for those services? Thank you.
Thank you, sir. At NHIF, we've made a provision to ensure that patients have access to services round the clock. I want to assure you that we've put up a call center whereby you can call a toll-free line, raise your concerns, and they'll be immediately addressed. On the issue of working over weekends, the management has put into place mechanisms going ahead to ensure that members can be able to access services, including emergency services. And we have told our providers, and for that matter we have about 8,200 hospitals that are empaneled with NHIF, that in cases of emergency, they should first attend to the emergency, then notify the nearest NHIF office of about a member who has accessed services at the same. On the issue of pre-authorization, because NHIF has put into place mechanisms to pre-authorize procedures, and when we are talking of procedures, we are talking of the surgical package, dental, optical, oncology, radiology, and other services. We have given our officers on the ground a turnaround time of less than 24 hours. I wish to acknowledge that in the past we've had challenges, but going ahead, the management is working overdrive to ensure that the system works seamlessly.
So essentially you're saying that at this point pre-authorization will be done even on Friday, because I've seen that question on social media as well. If you're discharged on Friday, there's pre-authorization, it has to wait until Monday, your bills keep accruing. Are you confirming now that that is not the case henceforth?
We've put into place mechanisms to address that. That is why we've set up...
It's yes or no, sir. Are you confirming now that henceforth that is not the situation?
Yes, Trevor. We've put up a 24-hour call center whereby emergency pre-authorization issues will be addressed comprehensively.
All right. Angela, are you satisfied with this?
I'm not quite satisfied, because I know... what I have seen in this country, working with different layers of the institutions like NHIF, the ministry, the other institutions, and even at the citizen, at the grassroots level, is that there's a missing link. And the missing link is communication and then in dissemination of the information. The issues that are maybe have been put up by NHIF or the Ministry of Health, how do they really reach the next level, which is the health facility, the health worker, and the citizen who is the consumer of the service? So I think maybe the systems are there, which I am not very aware of, but how then are they disseminated to reach that person? And then the other thing is, we are talking already about systems which are being implemented by a health worker who is already overburdened. We have very few health workers in the public sector. So how are we removing that other extra burden of someone who is already taking care of, maybe it's one nurse in a health facility somewhere or 2 nurses. There are so many cases, and now there's another layer of having to deal with the issues about NHIF. How then are we ensuring that actually we are giving service, taking care of this health worker and taking care of the citizen, and also addressing the issues that are coming up?
Okay.
I think there's something that needs to be looked at.
In terms of communication. And speaking of missing link, Dr. Swaroop, I've just received information from Nakuru here that Nema Letarkosh, a patient, has been detained in your hospital at Medihill for 2 months now for failing to pay 2 million shillings. You just told us that it is illegal.
Let me tell you very frankly, first of all, I apologize. In my hospital it happened. First of all, I apologize. And also I was under-informed about this thing happened, about from my hospital. Well,
So you don't know it's happening in your hospital as well?
I knew, and I also condemned. I told my GMs and all the operating officers to release them as early as possible. So they said me that they are connecting to the relatives and they are going to release them as early as possible. After going from here, I will see how many are there. I don't know. I have not. I don't know. I don't manage my hospitals. But if they have done mistakes, and I will take action.
All right. Thank you. Dr. Jackson, that's a commitment you've made on live TV, so that will be followed up. Dr. Jackson, how do we solve this issue? Because there seems to be a missing link in terms of communication from all the government institutions all the way down to NHIF and to the people as well.
Well, I think for us as a ministry, what we've done is to make sure that our communication strategy is very well articulated, ensuring that information reach as far as possible to the health workers. And it's also expected that the health workers, being the agents of change, they are able to communicate to their patients on what needs to be done. But you are right. The biggest problem that we encounter in the delivery of healthcare, it's about communication. It's not just communication from even the providers, but also from the patients. Sometimes we have that disconnect between the patient and the user of the service. My appeal is that when you go to facilities, you should be free as possible to communicate and to be able even to tell what are some of the issues you see that are affecting access to services and even the provision of quality of care.
All right. Mashirima, najua kuna maswali kadhaa.
Naam, tumezungumza sana kuhusiana na wagonjwa ambao wako hai, lakini pia kuna wale ambao hufariki. Tueleze swali lako. Simama tu.
Asante. Na mimi nilikuwa nauliza, sina wenye wamekufa na wana hiyo bili ya kulipa mocha, kwa nini wanafungiagwa? Nilikuwa tunataka kujua hivyo, kwa nini Kenyatta wanafungia miili, ama wewe umepeleka mgonjwa hospitali afariki una hizo pesa za kulipa, kwa nini wanafungiaga?
Trevor.
Dr. Jackson, how can this be regulated? And this question keeps coming around in different forms. Either the patients who are alive, they're still detained. Now she's saying that some of the relatives who've lost their loved ones, the bodies are still detained. How do we address this particular challenge?
Trevor, the same problem affecting the dead, it still can be tackled through the same manner. It is also socially unacceptable for relatives, for families who are pained by the loss of their loved ones, to have the dead of a deceased detained very unnecessarily. And what we do as a government is actually to communicate to those institutions and to tell them to release those bodies immediately, because it is not acceptable to keep a body we actually tell them to release the bodies of the deceased so that they can be accorded that decent burial. So Trevor, is not acceptable.
It's not happening.
It is happening. What will the government do
it
is happening, and we have communicated. We have communicated. We have issued circulars to all hospitals that it is not acceptable. Yeah.
Dr. Swarup, you want to comment on this? Because we still see it happening, despite the government pronouncing itself and saying it should not.
That is the reason our president, His Excellency and Deputy President, leadership, they wanted the universal health coverage. When universal health coverage with care will ensue, there is no need of no payment and no detention. Number one. Number two, my request that we should go back to the drawing board, and all the private hospitals and public hospitals, after the patient admitted and stabilized, the relatives should be given the tariff and should be counseled how much money it will be they will need to treat for the treatment. So they should have an idea. At the end of the day, we just give a big, long, hefty bill. So, they are not prepared, number two. Number three, I also request people that it should not be taken as an opportunity. Many people have money, but taken as an advantage, then not to pay. Okay, you just don't pay and go. That should not be also happen, because at the end of the day, patient has the right, yes. Also, hospital has their own right through different stakeholders. There is a doctor, there is electricity KPLC, there is a water, there is a bank for the loan interest, there is a supplier, there is a vendor, there is a ancillary services. So if there is a stakeholder, so we have to take all the rights into mind. Otherwise, this is our country. If we want health to prevail, we have to take care of all the rights.
There's a catch-22 situation there, but Mashirima, bado kuna swali.
Na maswali sasa yataelekezwa kwa NHIF. Terezia hapa na swali kuhusiana na usajili na nikina nani haswa ambao wanastahili kufaidika. Terezia.
Kwa majina ni Teresia Wanjiro. Swali langu ni hili kwa bwana na bibi kuhusikana na NHIF. Nimepitia magumu sana kwa bwana yangu kupata accident, na mimi ndio nilikuwa mwenye NHIF. Na vile aliumia nilifikiria vile nilienda kukata NHIF, nikamsajili hata yeye, kurudi kupatwa na hiyo ajali ya accident, kwenda huko hospitali ninaambiwa tunataka marriage certificate. Sasa ningependa kuelezewa wale hawana marriage certificate watasaidika aje?
Bwana Osoro.
Asanti Mheshimiwa Kapombe na asanti Teresia. Kwa mujibu wa sheria ya NHIF kipenge namba 9 mwaka 1989 ni wajibu ukiwa mwanachama wa NHIF uweze kuwa na cheti ama marriage certificate ili mke ama mume aweze kuwekwa kwa kadi yako. Ningependa kurudisha Wakenya nyuma. Miaka 2-3 iliyopita serikali ya Kenya iliweza kuidhinisha mswada wa Marriage Act ambayo ilisemekana ya kuwa kila Kenya aweze kuwa na cheti cha ndoa. The government passed regulation to make it compulsory that all Kenyans must have a marriage certificate issued from a competent office of jurisdiction. In the past, we made provisions for the churches, mosques to issue such certificates. But with the amendment in law, it became mandatory for every Kenyan to have a document to affirm that they are legally married. What I'll suggest to Teresia pengine, ungeweza kutembelea ofisi za serikali zilio karibu nawe. Uweze kuelezea na kuna njia ambako wataweza kupa cheti uweze kuweka bwanako katika kadi yako.
All right. But you want to jump in on that answer?
Yeah. I think, Trevor, and thanks. I think the same thing boils to the issue about, do we know what is required of us? And is there a deliberate action by the players in the sector, whether the government through NHIF, to educate Kenyans on what is really required of them? Because apart from just telling us, register for NHIF, do we know the other things that we ought to do? For example, the issue of Teresia that she's talking about. So I think, to me, I'm calling on all stakeholders, including the common citizen. When do you get to know about your rights, for example? How many of us understand what our rights as enshrined in the Constitution? How many of us know what is required of us, even as from an NHIF perspective? Or do we wait until that time that we go to the health facility, and when we are faced with these challenges, is when now we are taken back and we are like, then what do we ought to do? So I think it's upon us as citizens to get out and say we need to know our rights, and also the players to actually go out and set aside a budget to educate Kenyans when they roll out issues like NHIF, for example. How do we ensure that everyone else, instead of telling us watch TV and read newspapers, not all of us watch TV, not all of us read newspapers, not all of us have mobile phones that we can be able to access information. We have the marginalized, the blind, the deaf, and the like. How do we ensure that they get to know all these rights that we are talking about? So I think it should be the role of the players, the stakeholders involved, to really go out there and ensure that information reaches every citizen as it's supposed to do.
All right.
Yeah.
Ambalo linauliza kuna raia ambao hulipa NHIF kila mwezi lakini hawaitumii kwa sababu wana bima zingine ama wanatafuta matibabu kwingine. Na hili hizo hela zinaenda wapi? Na hili swali linapigwa jeki na Wycliffe hapa ambalo ambaye ana kitu zaidi kuongezea kuhusiana na hilo.
Okay. My name is Wycliffe Oduor. My question is that I am a contributor to NHIF. By bad luck, my spouse who passes away, is she entitled to the benefit of the NHIF that I was contributing?
Thank you, Wycliffe. And let me go back to your question that if you are a member of NHIF, NHIF cover is a family-based cover. It covers the principal contributor, that is yourself. You are declared spouse, and I want to repeat the word declared because if your spouse is not declared in our system, then she may not be eligible to access services. And declared children. Your wife is entitled to receive services so long as you've declared her. What I want to clarify, you can receive services at the time she's admitted in hospital. After her demise, then you cannot be able to access services.
I'd like to hear from lawyer Charles Mado here. You're the one who secured the suspended sentence for Murage, who's at the back. But what about the hospitals? Because what happens if I just walk into hospital and walk out? Because now I know it's illegal. They can't detain me. What legal redress do they have?
Brilliant, thank you. Well, Trevor, first and foremost, I want to reiterate that going to a hospital and getting medical services is a contractual obligation. That contractual obligation, you either pay for it or it is paid for you by NHIF if you're a contributor to NHIF. Now, as a hospital, when you enter into that contractual obligation as a private citizen or whoever you are, then that hospital becomes entitled to the bill that they give you at the end of your service, of your treatment, sorry. So the hospital has a recourse in debt recovery, because that becomes a purely debt recovery. You obtained a service and you did not pay for it. So the hospital can institute debt recovery proceedings against you. 2, that becomes a civil offense, if I may put it like that, where the hospital can again go to court and get orders to commit you to civil jail until either that debt is paid up in full, or until you serve your full sentence in jail.
Okay.
But thirdly, if you obtain a service knowing that you do not intend to pay for that service, it is again a criminal offense.
Okay.
So the hospital can be a complainant against you, and criminal proceedings can be instituted against you, and again you're found guilty of a myriad of criminal offenses.
Right, but can I also sue the hospital for damages in the event I was held in hospital for a while, or even my spouse was held and I feel like this was disrespectful? Can I sue for damages?
Absolutely, absolutely, Trevor. And there are numerous cases that have been decided in court where the hospitals have been reprimanded and damages paid in millions of shillings for unlawful detention. Remember, you have a freedom of liberty under you have a freedom of movement under Article 39 of the Constitution. You again have a right to liberty and a right to human, to being treated with dignity. And what the courts have decided is that in circumstances where you're held unjustifiably and without reasonable cause, and that's why hospitals now need to go to the courts to get that reasonable cause to either hold you or pursue such other remedies.
Okay.
You can sue the hospital and get damages.
Right.
But also, Trevor, just to add on to that, the courts have also decided that in circumstances where the hospital can prove its case as against a former patient, then the hospital can attach your private property.
Okay.
So the courts seem to decide that if you have land, or you have a car, or you have some other form of a property and you fail to settle your medical bills, and the hospital can prove that those exist, then those can be attached and sold either through a public auction or a private treaty.
All right.
Yeah.
And on that note, let's Monday report town hall session takes a quick break. When we come back, now you know you can sue the hospital, they can sue you. We'll be back in just a bit.